Aloha everyone. So in this lecture we are going to talk about the lumbar and sacral plexus, and they're sometimes just put together. There you might see in other references in textbooks. They just call it the lumbosacral plexus, and I'll show you why sometimes they're considered as one just big plexus. All right, so here's an overview of the nerve plexuses of the body. So we covered things like the cervical plexus and brachial plexus in other lectures, but here are the lumbar plexus right here and the sacral plexus. And notice that they're pretty interwoven like that. So that's why sometimes they just take lumbar and sacral and smash them together and you get lumbosacral plexus. That's what's referring to this whole network of nerves right here. Now, with the lumbar and sacral plexuses, if you're taking my class, do you have to memorize this entire and know this entire anatomy? Maybe for your advanced classes or like things like physical therapy or med school, but not for these class. If you're taking my class at the 100 level, what you should know is like look at these names of some of the major nerves that branch off of, in this case, the lumbar plexus. Things like femoral, genitofemoral, iliohypogastric, ilioinguinal, laterofemoral. So where's the femur? That's your thigh bone, right? And then genitofemoral, just put genital plus femur together. Iliohypogastric. So where's your hypogastric region? And where's your ilium in terms of bone? Then the ilioinguinal, where's your inguinal region? And where's that ilium as well? And then like femoral cutaneous, femur again, and obturator. So that obturator foramen in your pelvic girdle, that's also named after that. So it's pretty obvious that all of these would be in your lower body somewhere. Or I should say like kind of like the lower back and pelvis and lower body. Now let's go down to the sacral plexus. Again, it's showing you like parts that they're kind of like interweaving right here. So here's the lumbosacral trunk, and then this is connected down right here. So in terms of these, so here we have the lumbar and sacral plexus and things like gluteal, your buttock areas and muscles, and then you have femoral cutaneous. Now pudendal is interesting. So pudendal, the Latin root refers to shame. And the thing about the pudendal nerve is that it controls a lot of very important things, including muscles of the perineum. So what's the perineum? It's basically that area between the genitals and the anus. So that pretty much like that kind of span of that. That's the pudendal region. And so it's a lot of pelvic floor muscles that it controls. And the thing is that it's also very important for like kind of sensory innervation of the genitalia, but also control of the genitalia and anal regions as well. So people who have damage to that area, they might become incontinent and maybe like have trouble holding in their urine and feces or just going to the bathroom in general. Now, the sciatic nerve is a very big one, and this is a very thick one. Like you can't miss it, and it goes through the sciatic notch, greater sciatic notch, very big landmark in the pelvis, and superior gluteal, the glutes again. So that's pretty much like here is like the thing about the lumbar and sacral plexus is kind of complex because they kind of interweave as you go down the limb. So that's why I don't really focus on that too much at the 100 levels. But again, if you get the name of any of these, you should know that there are going to be in the lower part of your body. Now, here's the anterior, and you can see a whole bunch of them right here. But look at the back right there. And this old thick one, the thickest nerve in your body is the sciatic nerve. Like you can't miss it. It's probably the easiest nerve to see. And things that for a big old thick nerve like that, you need a big old thick passage for it to go through. That's why you have this greater sciatic notch, this huge indentation because you have this huge old nerve and other tissues running through it, but especially that nerve. Now, the things that when you have it running through this bony area surrounded by other tissues, things can happen to the sciatic nerve. So sciatica is basically this kind of like it could be numbness, it could be pain, it could be both. But either way, it feels like this whole sort of like numbness or pain along your entire leg because look at the sciatic nerve. It runs pretty much all of this entire part, especially this part up here. Now, the thing is that it's usually gonna happen on one side when you have this numbness or pain. If you ever sat on the toilet or anywhere for too long and then you get up and you feel like your entire leg fell asleep and it's numb, that is something called toilet seat neuropathy. And that's due to compression of the sciatic nerve. And look at the sciatic nerve. It's not only the sensory, big old sensory part, but it also innervates a lot of the muscles as well. So this is why you might feel that you're stumbling around as you try to get up after sitting too long, or sit not just on a toilet seat, but a hard seat can also cause that as well. But what happens, what's the common thread right there, is that you have something hard pushing against that sciatic nerve. So it's kind of like carpal tunnel syndrome. If you compress the nerve, that can cause sensory and that problems like the numbness and pain, and it can cause motor problems as well, like that control of all those muscles that are innervated by the sciatic nerve and its branches. So things like a herniated disc in the vertebrae, that's a common cause, and just like spinal compression, like the toilet seat neuropathy. And piriformis syndrome is something related. Sometimes so you might see it used like, oh, it's like almost interchangeable, but it's actually not interchangeable with sciatica. But they're kind of related. They're not the same, but they are related. So that sciatica is just referring to this general condition. It's not like a specific like cause right there. It's referring to this phenomenon. Now, piriformis syndrome, here we have the sciatic nerve and it goes through this greater sciatic notch, but you also have it has to thread through the piriformis as well. So, what between the bones and the piriformis? Now, things that there's it's a pretty narrow gap. So, what happens if this piriformis starts to press against the sciatic nerve and then you have this hard bone over here? The sciatic nerve is not going to be happy with that. So that is piriformis syndrome. Like, say it could be due to hypertrophy of the piriformis or just someone's anatomy. Like, there's actually multiple ways that this sciatic nerve can run through the piriformis and the pelvis as well. But this is like if it starts just smashing it against something hard or just compressing that sciatic nerve, that is going to cause sciatica and potential problems with sensory symptoms and motor control of the muscles of the leg. So yeah, here's another picture of piriformis syndrome, and yeah, this is showing a variation. Now the thing about our anatomy is like when you see the one in the textbook, that's the most common arrangement, but occasionally people have variations, and this is one variation. Sometimes people's sciatic nerve has branches and it goes through the piriformis muscle as well. So whenever this flexes, this poor nerves right here could get potentially compressed and cause symptoms. Now here's a something sign or I guess a symptom or something you can also see with sciatica is something called foot drop. Now pay attention to how this person walks and look at their feet. It's kind of hard to see from this angle. Now it's easier to see at this one. So notice in one foot, when they walk, take a step forward, they lift up, but the other foot kind of drags down, or I should say, just stays, kind of drags along the floor. So if you look at the left foot right here, when they take a step, they actually are able to lift it off the ground. But notice on the right foot, the toes kind of stay kind of limp and dragging along the floor, and that's called foot drop. So sciatica again is like due to compression of the sciatic nerve. So that's going to cause the sensory signal, the pain and the numbness, but it's also going to affect how this affect the control of muscles of the lower limb. So that, but things that the foot drop is caused by compression or lesions or of the peroneal or fibular nerve. So this is more in the lower leg. And when you have compression of that, so peroneal nerve, what does it do? It innervates the anterior and lateral compartment. We didn't cover compartments too much in that 100 level, but basically it's saying muscles in your front of your leg and on the side of your leg, they are affected by this and they're going to have loss of function or less function. So that means you can't really flex this and bring your foot up like that. So that's why that person's feet or toes were kind of dragging, because these anterior ones are very important for that. But also these lateral ones help with just the movement of that foot and keeping it up so you don't trip over your own foot every time you take a step forward. So how is sciatica treated? Well, it could be things like the common thing, safe ones you can buy these anywhere is like these NSAIDs, the non-steroidal anti-inflammatory drugs. We're just showing one example here. Or in some cases, they might, if it's a lot, especially the pain, they might do something like a corticosteroid injection, like cortisone, or muscle relaxants in case like they have other part problems with muscle, and especially like say that piriformis syndrome is and that contraction is causing that. That's something that could be, or physical therapy. So this is another common like strategy in physical therapy is like, say you don't want to do surgery on that. What you can do is try to relieve pressure and build up surrounding muscles. So you relieve the pressure of that, of whatever is compressing that nerve over there. And chiropractic alignment. So this is like, do I have strong opinions on this? Not really. But physicians and physical therapists, they have varying opinions. But the people who believe in it, what they think is that maybe by doing chiropractic and moving things around, they could move the sciatic nerve into a position that's less compressed to help with this person's symptoms of sciatica. All right, so that was a brief introduction. Now, it's not an in-depth coverage of the lumbar and sacral plexus, but we did cover general parts. It's kind of like a good start to it. And we also talked about something that's pretty common, like sciatica, and and you probably have felt that toilet seat neuropathy or something, their leg going numb, maybe from just sitting like on a hard surface. That is what's causing that problem.